what is the ideal setting for GSV, SSV perforator? So this depends on the diameter of the vein. So if you are treating a GSV which is more than 8 millimeter and if it is above the thigh and it is about having a very good fatty patient, you can give a laser energy of 10 watt and 100 joules. But if it is a thin build patient and though diameter of the GSV is 8 mm, you can reduce the watt to 8 watt and 80 joules. Below knee, you always remain less than 60 joules. Regarding the SSV, same thing applied, but you should not puncture the SSV below the bulk of the calf level. Secondly, you have to give low energy to the SSV because nerve is in close relation with the SSV, and below the knee it is in close relation with the GSV. So always below the knee there is less energy. I will advise to give energy of about less than 60 joules below the knee. Thirdly, how to tackle the perforator. So perforator is generally I prefer a laser ablation of the perforator, and if you do a good proper puncture of the perforator, you apply the energy when it enters the muscular plane. Regarding the perforators, laser ablation is preferred rather than sclerotherapy and other modalities of the treatment, and my personal experience with laser ablation is better for treatment of perforator. How to tackle the perforator? You puncture the perforator and you apply the energy where it crosses the muscular plane. What is amount of the energy you need to give? Generally you give 3 shots of 30 joules at the level of when it enters the muscular plane. How to treat superficial varicosities? So superficial varicosities, there are various patterns, like if it is an anterior tributary, posterior tributary or a superficial varicosities. If you ablate the perforator or if you are using a radial fiber for GSV and SSV, most of the perforator and superficial varicosities will vanish after the great saphenous vein and short saphenous vein ablation. You follow the patient for 6 weeks. Still, if this patient is having superficial varicosities or perforator, then you treat the patient. Regarding the superficial varicosities, you can do the sclerotherapy. For anterior tributary, you can give low energy, less than 40 joules for anterior and posterior tributary.